Hello everyone, you're watching sqadia.com and I am Dr. Hamad Haider. Today our lecture topic would be on osteonecrosis. Historically, osteonecrosis has been called as avascular necrosis or AVN, but as it was the most common type of necrosis in femoral head, but as the history evolved and as the medical sciences evolved, later on there were some other bones as well which are also susceptible to osteonecrosis. In the coming up sections, we'll be going through the general aspects. What is osteonecrosis? What are the types, and what are the risk factors of osteonecrosis? Then we'll be briefly going through the epidemiology, which kind of a population it affects, and what are the consequences of affected with that population. Then coming to the demographics, is it more common in males, or it is more common in females, or it is more common in Caucasian population, or it is more common in Pacific and Asian Islanders. Then in the second section, we're going through the different risk factors. Is it the traumatic AVN which is more problematic, or is it the non-traumatic one? And what are the systemic diseases which are involved with the osteonecrosis or avascular necrosis of the hip joint? Then coming to the etiology, what are the causes, and then the pathogenesis. What actually happens in osteonecrosis? What is the cause which actually leads to the necrosis of the bone? In the third section, we're going through the clinical symptoms, then how the patient presents us when he or she is having an AVN of hip joint. Mainly the most common it is the hip, but it could be other joints as well. It could be knee, it could be ankle, it could be shoulder as well. So it's just a pain which is the main symptom, or it is the pain with the range of motion is the main problem, or what else is the patient is actually suffering from. Then we'll be going through the examination, the features we get of AVN on examination. What are the features we have on hip and knee and shoulder. And then last we'll be going through the imaging and lab workup. What kind of x-rays we need to get done. Usually if the patient complains of hip AVN, we have to get x-rays pelvis. If it's the shoulder, it's the shoulder AP and lateral view, depending upon which joint is involved and what type of symptoms actually a patient has presented with. In the fourth, we'll be going through the treatment guidelines. That we are actually, first we have to get the history, examination, workup, and then we have to actually stage the disease. That is what grade it actually is. Historically it was FICARD, which actually started FICARD and Arlet, which were the first one to actually grade the osteonecrosis or AVN of the hip. Then it was modified by Steenberg, then it was later on modified by Arcos. So actually there are three classification systems. There is FICARD, there's Steenberg, and there's Arcos classification system as well. So usually the most commonly used is FICARD, but we'll also be going through all the three for the purpose of understanding actually what are the major differences. There's only slight differences, but yes, there are. And then we will be defining the disease based on these classification, where it is the early, it's the intermediate, and the late stage. And then what is the treatment of early stage, intermediate stage, and the late stage. Obviously, not all options are straight away surgical. Sometimes there are non-surgical options can also be utilized, such as splints, such as bed rest, such as non-weight bearing. But usually there is a very limited value. Mostly it is the surgical options which have to be utilized to relieve patient of avascular necrosis. So that for these includes core decompression, revascularization, this is hip resurfacing in osteotomies, then a vascular fibular graft, and lastly it is the replacement surgery, which is now in fashion, is a total hip replacement, total knee replacement, total shoulder replacements as well, a reverse total shoulder replacements. Then there are certain orthodesis options as well, like in ankle or in the wrist. For example, these joints, instead of getting replaced, it's better to orthodese them, because that also relieves them of pain, and there's a lot of functions actually maintained as well. Thank you very much. Keep watching sqadia.com.